Tell me a story.
Hi, I'm John Brady, and I'm from Newport News, Virginia, and I've been open now for 10 years. And one of the interesting things is about my practice is I still wonder periodically if we're going to make it. I actually joke with my nurse about it, and even last month I walking out and I said, I just don't know if we're going to be able to keep doing this. And it's become over the years really a running joke because so often I go and I shake my head and say I just don't know if this is going to work. And the reality is it's because it's really hard to run a practice right now. I mean, I think about probably 40, 50 years ago when the first village doctors were, or not first, but when the village doctors were actually doing their thing, what they have to worry about. They had to worry about, taking care of the person in front of them, and if they're going to get compensated by food or chickens or whatever, to make ends meet. I mean, now we've got technology and not just the latest stuff that we have to keep up with, but all the HIPAA regulations and all the quality regulations we have to deal with, and all the insurance stuff that we have to deal with, and it really can be overwhelming. And when I go to conferences um, in my state and I talk to doctors, what I find is that the vast majority of them, the most interesting thing that they talk about, what really excites them, is their 401k or what's going on with their investments or sometimes you can get them to light up if they talk about their children. But when it comes to their practice, they're like, oh yeah, I see patients. And they move on. You know, we've moved beyond the, oh man, this is a cool zebra that I found in this patient, and so this is neat. We've seen those, and so now there's kind of a drudgery, and so it makes me wonder. I mean, if you look statistically, like 60% of physicians are unhappy. In the state of Virginia, the VAFB did a survey, and like if they asked two questions. The first question was, do you plan on retiring in the next 5 years? And like 20% of people said they plan on retiring in the next 5 years. The second question, the follow-up question was, if you could, would you retire in the next 5 years? And 60% of doctors said that they would retire in the next 5 years if they could. I mean, it's really hard to practice good primary care right now. And so what's interesting, I mean, and so you have to ask the question, why, I guess. In 2009, Daniel Pink wrote this book called Drive, where he looked at what motivates people. And he said there are three things: a sense of autonomy that's able to control little things in your life, moving things, tweaking things to try and make it better. A sense of purpose. Is there a larger kind of goal for what you're trying to accomplish? And then a sense of mastery. Can you continue to get better and better and better? I think in today's medical system, the sense of autonomy is getting squashed. I mean, you're having people tell you how many patients you have to see a day. You're having to have all these other things that are just, I mean, insurance companies tell you can't have this medication or you can't do this procedure without doing this paperwork first. So the autonomy is getting really squashed. The sense of purpose is getting lost in the day-to-day drudgery. And honestly, a sense of mastery is hard to figure out because when you get out of residency, you're supposed to be a master at what you're doing. And so, where do you improve? I mean, sure, you go to continuing medical education, but that's just to keep you up to date. It's not really to help you get better because technically you're supposed to be the best once you get out of residency, although we know that that's not necessarily true. Um, what's cool about the IMP organization is that there's now the framework for opening up your own practice where you can get kind of that sense of autonomy. There's the framework for how do I make my practice better? And there's a constant drumbeat of all of this is central to the relationship that you have with your patients. And it's funny because the other thing that I never hear from anyone else is that by meeting the needs of the patient, it actually makes you happier. It makes the provider happier. I'm reminded of when I was on my honeymoon. You know, we're in the second week of our honeymoon. So I'm in the midst of marital bliss. We're at the Grand Canyon, one of the great wonders of the world. I am in this blissful sleep, and at 2 a.m., I get a sharp elbow to my gut, waking me up. And my wife yells, you know, move over and you're snoring. You know, so it wasn't just move over, hey, can you give me some room? Move over and you're snoring. And I realized at that point that making her happy makes me happy. That was a quick early lesson in our marriage. And it's the same thing, I think, with patients. If you make them happy, guess what? They make you happy. Now, there's boundaries. I mean, obviously, there's got to be boundaries. But when you make them happy, it also gives you a greater sense of satisfaction. When you meet their needs, it also helps you feel better. When you get connected to the community, it helps you feel better. When you remain engaged, it helps you feel better. When you continuously try and improve, and you have the breathing room to do that, it helps you get better. The people that I meet every IMP camp, and I've been to all of them so far, help to rejuvenate my battery. They give me hope that even though practice is hard, there could be a future. So that's what I want to say.